So in this last video of this course, we are going to see in short about the implementation of this new standard ISO 15189-2022 to the point of care testing facility. As I have mentioned, this standard is applicable to the point of care testing facility also. We can see how it can be implemented to point of care testing facility.
Now, as point of care testing is also included in this new standard. So there is an option for all the healthcare facilities to include this point of care testing facility under the management system of your central laboratory or as per the ISO 15189-2022. So before concluding this session, I have included this one slide on point of care testing facility or implementing the new standard in this point of care testing facilities. So what readiness or what preparedness are required? What are the necessary requirements are there to implement the management system in point of care testing facilities? So first of all, you have to enlist what are the activities, what are the different tests, what are the different areas you are going to cover in point of care testing facilities, or what are different areas where you are going to implement this management system for point of care testing facility under your central laboratory. What are the facilities required, infrastructure required, space requirement? Many of the equipment may require a specialized space for the carrying the testing activities. Waste discard facilities may be required. Dedicated storage facilities may be required for implementation of management system at point of care testing facilities. So you have to have a appropriate facilities for carrying out point of care testing activities. You must have operators and authorities and competency training of these operators. So you have to train the operators because the point of care testing activities are not carried out by the laboratory professionals. Point of care testing activities are carried out by nursing staff, by paramedical staff, maybe by some clinical assistant or even by clinicians. So these are not the laboratory trained personnel. So you should have appropriate competency and training of the POCT operator. What are their authorities? What are their authorities with respect to the review of the research? What are their authorities with respect to the different activities? Their authorities with respect to the handling of the specimens, discarding of the specimens, that you have to make sure and you have to train all these operators. Then you should have a service agreement. Your laboratory must have a service agreement with this POCT operator. Why? Because it is not the actual part of your laboratory, and even it is not handled by the trained laboratory technical staff. These are handled by paramedical staff, nursing staff, or clinical assistant. So you should have an appropriate service agreement with the point of care testing facility users. For that purpose, you can have a multidisciplinary care testing committee where there can be a representative from laboratory, there can be representative from medical faculty, there can be representative from nursing faculty, paramedical faculty, and quality faculty or quality areas, and other areas of those personnel who are related with the point of care testing activities. So you should have a multidisciplinary committee. Again, it is not mandatory to have a committee or multidisciplinary committee. It can be modified as per the requirement of the laboratory. Then you should have an appropriate quality assurance program for point of care testing activities. You should have appropriate IQC testing, proficiency testing, EQA whenever it is available, or other type of quality assurance program needs to be followed at point of care testing facilities also. So if you want to implement management system for your point of care testing facilities, you must consider these areas: POCT activities, facilities, operator training, service agreement, multidisciplinary committee, and quality assurance. So again, it is not mandatory again to include all the point of care testing areas of your healthcare of healthcare organizations under the laboratory. If it is possible, if it is feasible, you can include these areas under the management control of the laboratory, or it cannot be included as per the if it is not feasible. So before concluding, I have just two takeaway messages here, that laboratory activities shall be carried out in such a way as to meet the requirement of this document, the users, regulatory authorities, and organizations providing recognition. So this line I have taken directly from the standard, that whenever you are following any laboratory activities, you have to meet certain requirements. And what are these requirements for implementing the standard? You have to meet the requirement of this document. What are the requirements are mentioned in this document? You have to comply with the requirement of this document. You have to comply with the requirement of the users. You have to comply with the requirement of regulatory authorities. Regulatory authorities are healthcare authorities, or local regulatory authorities, governmental organizations. So you have to comply with the requirement of those regulatory authorities, and you have to also comply with the organizations providing recognition. So those organizations which are providing accreditations, those organizations which are providing certifications, you have to comply with those requirements also. So the laboratory must comply with the requirement of this document, requirement of the user, requirement of the regulatory authorities, and requirement of the organizations providing recognition or certification. The next takeaway message is laboratory management shall ensure that the integrity of the management system is maintained when changes to the management systems are planned and implemented. So why I have included this slide, and basically this is also taken from the document itself, that is clause 5.5.c. Why I have specifically included this clause? Because we are going to transfer the management system from ISO 15189-2012 to ISO 15189-2022. So there will be changes in the management system. So to maintain the integrity of the management system, to maintain the appropriate functioning and appropriate operations of your management system, whatever changes you are going to make, whatever actions plans you are going to make in your management system as per the gap analysis, as per the requirement, all those plans, all those changes you have to plan, and then only you have to implement. There should not be any sudden changes or sudden implementation of new guidelines. You have to plan the changes, you have to implement those changes, you have to monitor those changes, and then only you can see that you have implemented the new management system in your laboratory. So to ensure the integrity of the management system, you have to plan your changes, and then only you have to implement those changes. So with this slide, I am going to conclude this session on implementation of new standard with ISO 15189-2022 in your laboratory.